The next we will complete is our body fluids. Body fluids. Now see, if you look into your body, that means if you happen to go for a body mass composition, you will see that 60% of body weight is water. 60% of body weight is water. Around 18% should be proteins. Ideally, 15% should be fats, and around 7% is your minerals and your carbs and all. Okay, minerals hai, carbs hai, these are all. Okay, though we do not have a very ideal body composition, but 60% of the body weight is water. This is one important thing. This can also come as calculation. For example, a man weighing 60 kg, calculate his total body water. So this is the total body water. Total body water, which is divided into two compartments, ICF, that is intracellular, and ECF, that is extracellular. Right? Matlab dekho, this is your blood vessel. Okay, let us make it red. This is my blood vessel. And blood vessel will have got RBC. These are the different cells in the body. Okay, these are the different cells in the body. So only this pani, which is inside the cells, this water is ICF. And that is 40% of body weight. That is 40% of body weight. Okay? So 60% is total body water and 40% is ICF. This plasma, the fluid portion, this plasma, that is fluid portion, and the fluid which is present here, that is between the blood vessels and the tissues, which we called as interstitial fluid, is our ECF. And ECF is 20% of body weight. Right? So this plasma, that is the fluid portion of the blood, and the interstitial fluid that is present between the blood vessels and the cells is ECF. So remember, 60 is to 40 is to 20. 60 is my total body water, 40 is my ICF, and 20 is my ECF, like this. That means if there is 100 ml of water, 60 ml will be ICF and 100 ml of water, if the total water is 100 ml, 100 ml में से 2/3 will be ICF and 1/3 will be ECF. देखो, see. So the total body water is 60% of body weight. ICF is 40% of body weight. ECF is 20% of body weight. So this is body weight. And if you take water, suppose the total body water is 100. Out of that, 1/3 is total, 1/3 is ECF. 100 में से 33% is ECF. And 100 में से 67%, मतलब 2/3 is ICF. So this can be calculation to you. So don't be confused with that. ECF has got interstitial fluid and plasma. So interstitial fluid around 14 liters, around out of 14 liters, it is 10.5 liters. This is 14 liters. And plasma is 3.5 liters. So if you take a man weighing around 70 kg, 60% of the body weight is water. That means total body water will be 42 liters. 42 liters में से 28 liters will be ICF and 14 liters will be your ECF. उस 14 liters में से 10.5 is interstitial fluid and plasma 3.5. This is the body fluid which is present in body cavities, that is CSF, pericardial, pleural, synovial. This is called as transcellular fluid. And transcellular fluid is also a part of ECF. Transcellular fluid is also a part of ECF. ठीक है? Is it clear अब तक? So you can also remember one thing. ऐसे भी हम याद रख सकते हैं. Total body water is 0.6 into body weight. ICF is 0.4 into body weight. ECF is 0.2 into body weight. Plasma volume is 25% and interstitial fluid is 75% of ECF. So this is the different ways it can be asked to you. Now you can calculate your body fluid. It is called as, the formula is V is equal to Q upon C. Sometimes it may be Q minus E, where V is the volume of the compartment to be measured. Volume of the compartment. That means suppose I want to measure ECF or ICF. Q is going to be the quantity of the substance that is used. Quantity of the substance. Every compartment will have a different substance. C is the concentration of the substance. C is the concentration of the substance. And E may not always be provided to you. E may or may be present or may be absent. It is the quantity of substance metabolized or excreted. Metabolized or excreted. For example, how does it happen? Suppose this is the compartment I have to measure and the compartment is having fluid. I have added a substance X. Okay, I have added a substance X. That means the quantity of the substance is given to me. Suppose it is 5 milligram or whatever. And after some time, this is going to get dissolved nicely and I can obtain its concentration. I can obtain its concentration. And if the question says that out of 5 milligram, 1% got excreted or 1% got metabolized, then that is E. Otherwise, E may not be given. E may not be given. Got it? So it is not necessary that E may be given to you. Even V is equal to Q by C will be given to you if it is a calculation based question. Now see, ये question देखो. Albumin is used to estimate. That means every compartment has got a specific substance that is given to measure that. that substance should be such that it should be metabolically inert. It should not bring about any reaction in the body. And ideally, it should not be metabolized also. And it should remain in the compartment. Suppose you have to measure ECF, it should go into the plasma and the interstitial fluid. Suppose you have to measure total body water, it should go into the ICF and the ECF. So that should be the compartment. So you have got different substances. For example, for total body water, D2, that is deuterium oxide. Deuterium oxide. 3H2O, that is tritium oxide. Then there is antipyrine, aminopyrine, which can be used. For ECF, sodium, inulin. ICF, for plasma, albumin. For blood volume, chromium labeled RBC. Deuterium oxide is the best one. And यहाँ पर inulin is the best one. It is not insulin. Now, as far as ICF and IF is concerned, both of them are measured indirectly. Indirectly. Indirectly matlab there is no substance which can only go into ICF or only go into IF. So how do you measure? Interstitial fluid, definitely it will be ECF minus plasma. ECF minus plasma. Okay. And so what two substances are used to measure IF? ऐसा क्वेश्चन आता है. So ECF के लिए हम क्या यूज कर रहे हैं? इन्यूलिन. प्लाज्मा के लिए हम क्या यूज कर रहे हैं? एल्बुमिन. ऐसे. Plasma can also be done by Evans blue. Abhi ICF is total body water minus ECF. That means we can use deuterium oxide and inulin. So this is indirectly we are obtaining the interstitial fluid and intracellular fluid. हाँ, बबीता मैं थोड़ी देर के बाद करती हूँ 7 बजे. ठीक है. Done with this, bacha party? Done with this? So total body water, calculation, substances which are used and the formula for calculating. अभी इसका आंसर बताओ मुझे. Albumin is used to estimate what fluid? Yes, plasma. Very good. Very good. It is plasma. Very good. मुस्कान को समझा, आकांक्षा को समझा, बाकी बच्चा पार्टी आई होप यू ऑल्सो आर अंडरस्टैंडिंग वेल. वेरी गुड मोहिता. आज मुझे ये नहीं दिख रहा है बेसल, शिवानी नहीं दिख रही है और मानसी आ गई है. Gurpreet or something with Gur was there yesterday. Yes. Joy. ऐसे कुछ कुछ नाम मुझे याद हो गए. चलो. Now, this also comes to you, that edema pe you get a question on edema. Now, what is edema? Okay, what is edema? So it is basically collection of fluid in the interstitium, collection of fluid in the interstitium, right? Why will fluid get collected over here? Fluid will get collected over here if there is any problem in these starling forces. The starling forces that are helping in the exchange of fluid across the capillaries, in the exchange of fluid across the capillaries, right? So there are two important forces, very easy. First is P, that is hydrostatic pressure. So this hydrostatic pressure will be here in the capillaries also and in the interstitium also. In the capillaries and in the interstitium. Second is colloid osmotic pressure, or you also call this oncotic, which is given by pi, which will be also in the blood vessel, that is in the capillary or in the interstitium. Remember, to make yourself very easy, hydrostatics are pushing forces. They will push the fluid. मतलब जहां पर भी hydrostatic pressure ज्यादा हुआ, the fluid will be pushed on the other side. Colloids are pulling forces. Pulling forces. मतलब they will pull in the fluid. And remember, the colloidal osmotic pressure is maximally contributed by albumin. The colloidal osmotic pressure is maximally contributed by the protein, that is albumin. So colloids are pulling forces and your hydrostatics are pushing forces. Okay? So the net filtration pressure is PC, that is hydrostatic pressure minus hydrostatic pressure of the interstitial fluid minus colloidal osmotic pressure of the capillaries and plus interstitial fluid pressure. Okay, interstitial fluid colloidal osmotic pressure. So the fluids which will increase the movement of the fluid from the capillaries to the interstitial fluid. Okay, that means those which will increase filtration. This force, that is PC. So if in any condition, the PC is more than normal, that means there is more fluid in the blood vessels, which is increasing the hydrostatic pressure and causing the fluid to get pushed from the capillaries into the interstitium, will increase fluid collection. Or if there are proteins over here, isn't it? Proteins, it is a pulling force. So the second force will be pi, that is interstitial fluid ka colloidal osmotic pressure. Interstitial fluid ka colloidal osmotic pressure. So if the colloidal osmotic pressure is more in the interstitium, that is if there are more proteins in the interstitium, it will pull the fluid. It will pull the fluid. So these are the two forces which are increasing filtration. But if they become abnormally more, then what will happen? There will be edema because fluid will come here. Those phases which oppose filtration are colloidal osmotic pressure of the plasma or of the capillaries. Colloidal osmotic pressure of the capillaries, because if there are more proteins over here, it will exert more colloidal osmotic pressure and the fluid will be dragged inside, right? And second, if you increase the hydrostatic pressure of the interstitial fluid, normally this hydrostatic pressure is less, it is never more. But if you increase the hydrostatic pressure over here, what will happen? It will push the fluid into the capillaries. So opposing forces and favoring forces. So normally they are well balanced. They are well balanced so that there is filtration at the arteriolar end and there is reabsorption at the venous end, right? There is filtration at the arteriolar end and there is reabsorption at the venous end. And if there is small amount of extra fluid, around 1%, it will be returned to circulation by the lymphatics. So lymphatics play a very, very important role in preventing edema in the systemic capillaries as well as in the pulmonary capillaries, right? Lymphatics, they take away the extra fluid and return it back to the circulation. And therefore, if the lymphatics are obstructed with any cause, there can be edema. Right? Did you get this? So anything which is in excess, if it is more hydrostatic pressure of the capillaries or if it is more colloidal osmotic pressure of the interstitium, है ना, कुछ भी अगर ज्यादा हुआ, ये lymphatics नहीं काम कर रहे हैं, so fluid will get accumulated. Like if you consider the example, see, whenever there is an increase in the capillary hydrostatic pressure, this will increase the interstitial fluid. For example, standing, prolonged standing, and if there are incompetent veins. Increase in the venous return to heart, increase in the venous return, excess of blood flow, hypervolemia, venous obstruction, cardiac failure, the patient comes with edema. If there is increase in the oncotic pressure in the interstitium, especially this occurs when there is accumulation of metabolites like in exercising muscles. Okay, but this is not severe. This will apne aap se go down. After some time, the metabolites will be washed out only with severe exercises. So it takes time. Gradually, there is wash out of the metabolites, right? Then, if there is a decrease in the colloidal osmotic pressure of the capillaries, one of the very common cause, when the proteins are lost, it could be nephrotic syndrome, it could be cirrhosis, it could be hypoproteinemia, any condition. When the proteins are lost, the colloidal osmotic pressure decreases. So something to hold the fluid in the capillaries is lost and there will be edema. The fluid will come into the interstitium. Then increase in the capillary permeability. It could be by chemicals like substance P, histamine, anaphylaxis, and again increased capillary permeability will cause edema. जैसे you get injury, ना, suppose there is a pen stroke, you get injury, that small area gets edemated. और अगर बहुत ज्यादा हुआ, anaphylaxis means a very severe antigen antibody reaction, it can result in a massive edema. Or lymphatic obstructions. For example, after surgery, when you do a radical mastectomy for breast cancer, or elephantiasis, lymphatic obstruction, and reduced lymphatic flow is one of the important cause of obstruction. Got this clear? I hope you will be able to write the MCQ, I mean, correct MCQ, once you understand the forces which will increase filtration or increase reabsorption and what are the factors which can cause edema. ठीक है? Now we look into our action potentials. See, these are very, very important simple one-liners. Very important simple one-liners. जैसे कि ion contributing maximum to osmolality. Ion whose equilibrium potential is nearest to RMP. Ion which is most diffusible at rest. Ion with no contribution to RMP. So these are the simple one-liners which come to us. Okay, but uske pehle you must always remember this table. This is a very, very important table that helps you to know the differences between the ECF and ICF. So the major cation of ECF is sodium, and that of ICF is potassium. The major cation, the major anion is chloride, and यहाँ पर it is phosphates. But apart from chloride, even the bicarbonates are more in the ECF, and apart from sodium, calcium is more in the ECF. और यहाँ पर potassium, magnesium, phosphates and proteins. Remember that bicarbonates is the major ECF buffer. And proteins are the major ICF buffer. Though the composition is different in the ICF and ECF, the pH in the ECF is 7.4. The pH in the ECF is 7.4. The pH in the ICF is 7, slightly acidic because of the metabolism. But दोनों में what will be same? Osmolarity will be same both in the ICF and ECF. Both. It will be 280 to 290 milliosmoles per liter. So the osmolarity is going to be same both inside and outside. Same osmolarity. Done? हुआ इतना? So most important is the ionic differences. Again, the reason is the selective permeability of membrane. The reason is the selective permeability of the membrane, which does not allow anyone to come inside and outside. Yes, good. Now,